One of the sessions that'll be very interesting this year is a whole section dedicated to what the current updates and practices are for treating patients who have been previously untreated or treatment naive. So we'll hear from several speakers summarizing the current practices and perhaps looking forward for younger patients, also in looking for treatments for older patients. And then we'll hear updates and summary of data from some of the recently reported Frontline trials. So I'll be speaking on the Alliance Frontline study comparing a ibrutinib-based regimen versus bendamustine rituximab in older patients as frontline treatment for CLL. And then we'll also hear the updates and summary of data for the ECOG younger patient study, as the CLL14 looking at venetoclax in the frontline setting, as well as the ibrutinib combination studies. So it'll be a good time to hear summarized again the recent published data, as well as see some forward thinking of how patients' frontline treatment will shape up with the availability of these drugs moving forward.